Hi everyone. I don't think you could have got a better talk about a journey through of tenacity and of focus that you just had. Don't be fooled by my colleague's dulcet tones. He has steel and his leadership style is very effective. So I think you've just had a great talk and a great example that you should model. I focused my talk slightly differently from what Chris has spoken about. I'm going to tell you a little bit about my journey, but I wanted to also talk to you a little bit about what leadership means. I think Josh's question was an interesting one, and Chris did answer it. Managing people is not the primary goal of leadership. Leadership is for you to inspire the people that you lead to be the best versions of themselves. And his last slide on authentic leadership, that details that. So my journey story is somewhat different. It's clear I'm not from Adelaide. I was born in a small town in Malaysia called Ipoh. Does anyone know where Ipoh is? Well, if you go to Kuala Lumpur and you drive north for 2.5 hours, you'll get to my hometown. It is a town that is between Kuala Lumpur and Penang, the famous destinations everyone knows. And it was founded on tin. Now, I went to that school, the Anglo-Chinese school, and I want to tell you a little bit about the history of that school because it's an inspiring story. At the back of the school hall, which is just in the middle of that, is a photograph of an old man with a much grayer beard than me, white hair, and a clerical collar, the Reverend W.E. Hawley. In the early years of the 19th century, Hawley came as part of a mission to Malaysia. He was at that time 24 years old. And his goal was to build a school as part of his Christian missionary zeal. But Ipoh was a town of tin miners, and they were from several different Chinese clans. And he was trying to figure out what to do. So he went to one of their clan society meetings, and he found himself in there, and he said to them, look, I need you to help me build a school. And they looked at him and said, well, why? So he said, well, because it'll be good for, the British are here and so on, and they still weren't convinced. Then the head of that clan society said, we'll give you some money to build a school on the one condition: you teach us English. And so, because that would mean that they could interact, engage with the English and benefit economically. But Hawley said, no, I'm not going to do that. I will teach your children English. And for me to teach your children English, you need to help me build a school. The original school class is still there. He had 4 students. My school has an enrollment of 2,200 students 130 years ago. Now, that story is a very charming story, but it showed something, It showed focus, it showed a sense of leadership. He took the onus on himself to problem solve. My early experiences of being a leader came from understanding how to be a member of a team. So I don't know whether you can see, but the bespectacled guy standing on the left is me. It's not a great photo. So I used to open the bat. I don't claim to be a great cricketer, but I was a reasonable opening batsman, and what you'd call a part-time off-spinner. What about the things about this team that really made it a team and and as it so happens, I was the captain. One is we knew each other. Secondly, we all had a shared purpose. We wanted to win. But we also had something that bound us together, which was that we enjoyed playing cricket, and we all had the same values. There was no helmets then. I've got a chipped tooth from a and I've got a crossbite because of getting hit by a cricket ball. And I think when I came to Australia, I had to have a chest x-ray because I was an overseas student, and they found a callus. And then I remembered that I got hit on the chest. It was actually a full toss. It wasn't a fancy bouncer or whatever. I thought I was going to hit it out of the ground. Completely miscued. It hit me in the chest, and I was sore for a few days. So my learnings of leadership stem from understanding what it was like to be part of a team. I came to Australia before most of you were born, in 1981. I went to Melbourne. I went to a high school in Melbourne called McKinnon, and I did year 12, as it was then known. My brother and my sister had preceded me. We were overseas students from Malaysia. My parents were teachers, which taught me the value and joy of teaching. My father happened to be the principal of my school, which was actually not good for me, because every start of every form, my form master would stand in front and explain in very strident tones. It didn't matter who your father was. He could be the King of England. You will be treated the same. That was not true. I got treated worse because I think the schoolmasters were trying to prove to my father that they offered me no favors. But that was fine. I enjoyed that. So I came to Melbourne in the early 80s. Melbourne was very different. My brother and my sister had already gone to Monash. They were at university. So my parents thought they would look after me. The first thing my brother and sister said to me when I came to Melbourne was that they were going to leave me alone. And the reason they did that was because they felt that I needed to learn to, manage myself. And so it was a little bit challenging, but Australia is a great place. The first thing I found was I found a friendship group, and we managed to get through and get the marks. At that time, as an overseas student, you could go to the University of Melbourne. We had 11 places out of the, I think, 190 places, and I stumbled in, and that was when I started my surgical career, because I actually knew from a very early part of my medical career that I wanted to do surgery. I had no immediate members of my family who were medical, but my grandfather was a doctor, but he had died prior to the Second War, and it always fascinated me that that he was able to fix people. I had my appendix taken out when I was 7 in a provincial hospital, and I was fascinated. This was the days they give you the appendix in a little jar, I was fascinated that someone could open me up, take that thing out, and put me back together again. My clinical school was at the Royal Melbourne, and like what Chris described, I came across many doctors, many surgeons who really served as role models. They were technically very good, they were diligent, they knew how to teach, and they were disciplined. So the other thing that I did at university was I wasn't really that attentive, but fortunately I scraped through because I discovered student politics, and I discovered the energy that being engaged in student politics was. Which political group did I belong to? Well, I headed up the Melbourne University Overseas Student Society. We had a block of 1,500 votes, so when it came to union elections, everybody wanted to be our friend, and we voted in the block. I also founded the Overseas Medical Student Society, which was great because it gave a home to medical students. Now, I was fortunate, my parents were teachers. I spoke English at home, although my instruction was in Bahasa. But many foreign students don't have that ability to integrate with the Australian students, and that isolation actually is bad, because we would do pretty well in preclinical years. And those days it was year 1, 2, 3 preclinical. Year 4 you started seeing patients. And when it came to talking to patients, etc., overseas students were just culturally not able to do that. We were far better looking at a book, and so the Overseas Medical Student Society was about integration. Leadership lesson there in founding the Overseas Medical Student Society, and my roles in political moves, groups, was that I learned the value again of, or I learned some lessons, and I wasn't always successful at it, because how to actually engage with people to bring them together. Okay, you have to identify a common cause. So I'll come back to this in a minute, but my path through to surgery was, as an overseas student, I had to finish my intern year. I got an intern year, but I had to finish my intern year to return to Malaysia before I could come back and commence surgical training. That was the immigration rules at that time. But during my undergraduate years at Royal Melbourne, I was fortunate to have the support of some senior surgeons who helped me navigate that immigration pathway, so that I could stay on and commence my junior resident years. So I did, we call it JRMO, junior resident. And then if you were a good junior resident, you then got recommended by the professor of surgery, the late Gordon Clooney, to the anatomy school to be a demonstrator and a prosector. So you spent 6 months demonstrating to the medical students. During that time you were expected to get your primary, and after that, once you got your primary, you then were expected to continue as a demonstrator at anatomy school in anatomy and physiology, but also go back and do ED shifts and do relieving work. And that was good. Then I came back to the Melbourne, did a senior resident year, and primed to move into advanced surgical training, because I got my exam, but nobody was allowed to go into advanced surgical training without doing a non-accredited year. And that didn't matter how bright you were. That was the pathway. So when you're talking about the pathways to surgical training, they can vary from institutions and from states, but I'm talking about a pathway quite long ago. And then, like Chris, my first intern rotation at Royal Melbourne, I was rotated to Wimmera Base Hospital, Horsham, and I learned heaps. And my surgical education started, as Chris was saying, very early on in the piece, as a medical student, holding retractors, reading up on procedures before smarming my way through to becoming, first assistant, those sorts of things. But the country rotations were great. So senior resident, went on to getting selected to general surgery, and I completed my general surgical fellowship in 1999, and that was the prerequisite for doing vascular training. And I got into vascular training actually in 98, 99. I rotated through the Alfred Hospital, the Austin, and Royal Brisbane. By that time I was exhausted. We had a child, and we didn't do the overseas thing. The previous head of service at Queen Elizabeth had a TIA while operating, and so they were looking for a locum. My wife at that time was, I think she was an acting wing commander in the Air Force. She's a doctor, and she got offered, Mr. Air Force were kind to us, moved her around with my various rotations, and they appointed her to be the CEO of a RAF-based Edinburgh health flight. So that made it good. We both came here. I was here we were supposed to be here for 12 months in 2001. We came with one child. We forgot to leave. Now we've got 3 children. My daughter Hannah is a 50th medical student, completely loving it at Kapanda. She's at Kapanda doing a rotation. And I got 2 boys. Sam finished a BCom at Melbourne University, works in an investment company. His bonuses are eye-watching. I don't know why I'm doing medicine. And young William, our youngest, has started as a Chancellor Scholar at University of Melbourne. So very proud of my family. But like Chris, they're the foundation of your working life. So I become a vascular surgeon. First job, Queen Elizabeth Hospital. I might have met Chris pretty early in the piece, because as a junior consultant, you're doing a lot of service work, you're doing a lot of teaching, training, and so forth. My journey through leadership is very different from Chris, because I developed a private practice and worked in the public sector as sort of a 50-50 split, and then I probably did a bit more private than public work. I was never head of unit. I was a senior surgeon in the unit. The units merged. We came to the Royal Adelaide. But during my years before coming to the Royal Adelaide, I developed some leadership. I call it leadership practice, right? Because you're never the complete version. And I know I'm talking to medical students and residents, junior residents embarking on a surgical career. Leadership isn't something you develop and that's it. Leadership is something you practice at. But you've got to be intentional in your practice. So a few photos of my practicing leadership. I became involved in the State Committee of the College of Surgeons, which gave me access to other specialties, but also pretty much in the domain of surgery. I served as the chair for a couple of years, I think 2013, 2014. I served as 9 years on the board of vascular surgical training, and as a supervisor of surgical training, and did foundational courses in teaching and education. Again, intentional upskilling. And then I served as 9 years on the Society of Vascular Surgery, the ANZ Society, and I was fortunate enough to be elected president for a couple of years, and that's me being thanked on the right. During my time as Society of Vascular Surgery, I got fortunately again, I don't quite know why, but I think there was the Americans didn't like the Europeans, and the small group of South African vascular surgeons didn't like either. So I got elected president of the World Federation of Vascular Societies, and that was a great honor, but also a way of understanding how vascular training occurs in so many other countries. Chris was talking about specialty surgery versus non-specialty surgery. Our surgical training program is very advanced compared to many parts of the world. But I've been a surgeon for maybe 25 years, and if you add my registrar years, I can say to you that training in general surgery is the foundation. Now, that doesn't mean general surgical fellowships, but training in surgery in general is the foundation of all surgical specialties. And I think Denby would also agree that although a lot of our work is endoscopic or endovascular, etc., but the ability to open up do a laparotomy or a thoracotomy, or at least understand how to do open surgery, is key. 2015 we came to the RAH. We were one unit. I was a surgeon in the unit. 2017, the new hospital opened. Cordamenta came in to fix us up, and in 2019 someone suggested that perhaps I would be suitable for the role of medical lead. So I have a role very similar to Chris, and I look after certain groups. I want to tell you a little bit about the challenges of looking after subspecialty units that you are not of. So you might have technical skills in a particular area, but your leadership skills are actually transferable. But you need a few things. You need to be curious. You need to understand what it is that you know, and you need also to be humble. You might be the king of your operating theater, but you're not able to understand, you know, transperineal biopsies or you know, corneal implants or pelvic mesh clinic. You rely on other people, and like Chris says, you need to develop those authentic relationships. I want to tell you a little bit about leadership elements, and then we can talk a little bit. I don't think that we have formulated a robust leadership paradigm in this country. And it's not a criticism, it's just a cultural norm. We focus, rightly or wrongly, on the right of the individual over the right of the organization or the community. In other countries where the social norms are a bit different, like Singapore, their ability to create a paradigm of effective leadership is a little easier. Now, you can argue, Singapore started as a British cantonment in 1821. Today, it's something like that. We visited the Singapore General Hospital, which I think is ranked the third best hospital in the world if you're into rankings, or eighth. Their population base, I think, is at the moment 5.5 million. 40% of their country is on reclaimed land. And they have a very different way of planning their health care, but they're future focused. And how does this relate to the talk that I'm trying to give you? You need to invest in some of your future, and the investment has to be intentional. Every one of these doctors that I met in Singapore who were at a senior executive level were already established surgeons, pediatricians, etc., but they intentionally train for the roles they occupy. So while we've talked generally about the elements of leadership, if you take on a particular leadership role, whether it be head of unit, medical lead, chair of clinical council, or whatever, there are certain elements that you need to have. And some of those elements, I think we'll talk about. I just want to also show you this really cool slide. This is primary health. What has it got to do with surgery? If these guys get it right, we'll probably not have work to do. But they invested $4 billion over 4 years. And the thing here is that their leadership was to say that each individual person in the community was the leader. Your health outcomes were you know, pretty much your own responsibility. They have apps, they have digital. I guess all these are examples of, you know, they've got a robot in most of their hospitals that's a proton accelerator and so on. So this is a country small. How did they get there? They got there because they have three master fundamentals of leadership. They have a set of values. They have trust, and they have integrity. And whether you're the, you know, president of the Medical Student Society or the CEO of a network, those are the three elements that will make you, you know, a thoughtful and effective leader. I like this slide because it showed me something else, this form of collaborative leadership. So in Singapore, if you wanted to be, and there's an app for everything in Singapore, you could volunteer to be a night sitter. So you know all those guys we have here, Celsius, so you know the security guys? Instead of security guys, they have members of the community volunteering to sit, and there are certain incentives, you know, free transport and so on. This other one I really liked was the wearables. So there's an app you can connect to in Singapore. You do 10,000 steps or something for 3 months every day. You get 10% off on your groceries. I think that's, you know, so what is it, guys? I'm saying that leadership also can be innovative, all right? And some of the innovations actually don't cost much money. Recognize each other. I really like that example, because leadership isn't about yourself. It's about the people you lead. So they have these things where, you know, weekly, they're recognizing each other for genuine achievements. If you as a leader are able to encourage the recognition of others and develop others, whether it be someone helping, you know, a person through a difficult exam that they're having difficulty getting through, someone having a medical student that doesn't seem to be engaging. Those are things that you can do as a leader that actually don't benefit you, but benefit people around you. Interestingly enough, it benefits you as well. I couldn't help this, but the guy with the glasses is actually a nephew of mine. I was walking down Singapore General, and there he is on a thing, and I just had to take, and that's a hybrid suite that Leslie Dwyer and I. Leadership, and I know we're talking about leadership in surgery. Chris and I are in a part of our leadership journey now, where we are leading beyond surgery. But you saw already with Chris, his intentional upskilling. The old days of the person being the most senior person in the room with the most gray hair, or in Chris's case, the least gray hair, becoming the leader is no longer the leadership paradigm. And some of this here, your opportunities to lead are quite interesting. Yesterday I heard from a talk here. We are an aging society, but we actually have about 10 years or so before we have, you know, 30% of our population over 70. Some other places in the world, they're going to get there a lot quicker. And so we're looking at things like future workforce, innovation in technology, artificial intelligence and analytics. I mean, stuff that back in the 80s I would have had I wouldn't even know. I don't think we had the internet back in the 80s. So you've got lots of opportunities to develop this, but if you develop it in the context of becoming leaders in your field, that would be what I would say. Anyway, that's just it. So I'm coming really to the end. This is probably what I learned from Singapore. That's what I learned. The master fundamentals of any leadership is having a strong ethical base, integrity, honesty, and with that comes trust. You must, as a leader, sometimes be able to say no. Difficult to say no, and your temptation is to say, let's do a business case, let's do a pilot, whatever. No, I think we just need to be able to say no, have the courage to say no. As a surgeon, I would say to you, don't take on significant leadership roles until you're comfortable in your skin. You need to have strong technical capabilities, and you will, because to become a surgeon, you will need to have skill, tenacity, and intellect. And I know Chris was saying earlier, you can get involved in things, etc. But I would maybe vary slightly. I don't want you to stop your technical journey to becoming a surgeon, and some do that, some might, I would suggest, unless you're, and I wouldn't be able to do it, I would have had to do, and then become a confident surgeon, confident in your own abilities before you take on positions of trying to lead others. Now that confidence isn't because you say you're the best. That confidence is because you know your level of competence. And that may not be because you're the best aortic surgeon or you've done the most, stents or whatever. That comes from because you know your limitations. That makes you a far more successful technician than someone who doesn't. And at the end of the day, you need strong teams. Your teams are based on your ability to create, unity. Your ideals need to be translated into actions, and you have to, whether you're an intern, medical student, medical lead, CEO, you have to retain your principles, and you have to be learning all the time. So these are my current roles. Since I've got my medical leadership role, I chair the clinical council, I'm a medical observer on the Carlin governing board, and I am on the clinical governance, finance and investment, audit, risk, people and culture. So various different roles. Anything to do with vascular surgery? Not much. But it has everything to do with vascular surgery, because the leadership is to create the capacity for others to be the best they are, not just vascular surgery, urology, etc. And we're not succeeding all the time, but we're striving all the time. So I did a few different things, like Chris. I got an aphragma. I went to Harvard Med School, did a surgical leadership program by modules that taught me things. And the really interesting thing was the 180 other surgeons from all other countries with different levels of skill. I'm currently undertaking a senior executive MBA at the Melbourne Business School, and that will give me probably a bit more perspective on management. And I've completed the I'm a graduate of the Australian Institute of Company Directors, which is about governance and understanding things. Last slide. This guy impressed me the most, and you can find him on YouTube if you get an opportunity to follow him on LinkedIn or just read his book. It's about deep purpose. If you don't understand why you're doing the things you're doing, it's going to be very hard to lead. Understand why you undertake surgical training, understand why you decide you want to be a urology head of unit or a medical lead or a chairman of a board. And there's a YouTube clip that I encourage you all to go. It's a soap ad. It's based in India. As a little boy comes out of his mud hut and he sees footprints on the sand, and it's his father walking on his hands to a temple, and there's a lot of people following him. A visitor in a bus says, what's the fuss? And the village elder said, oh, he's celebrating, and that's his vow, to walk on his hands. What's he celebrating? His son, the little boy that comes out of the hut, has turned 5. And they said, well, that's very interesting, but what's the deal with that? I says, well, it's his only child that has turned 5, because everybody else died of dysentery. And that ad was a soap ad. Lifebuoy, who donated money towards developing, water systems. That is an example of purpose. And your leadership must come with purpose. Final slide, I've been saying that actually. You also need to know when to leave. You cannot be a leader ad infinitum. The first thing you need to do once you've established your leadership credentials is work out who's going to take over. So last week I climbed Mount Kinabalu, which is the tallest peak in Southeast Asia. and that's my wife. And you never do the leadership journey on your own. It's always, people around you. And sadly, my footy team didn't make the finals. So thank you for listening. I hope it made sense and of some value to you. Happy to take questions if there are any.
You had some very tangible practices that were being used in Singapore that I don't see necessarily here. How do you think we can integrate those and bring those to South Australia?
Yeah, long answer to that question, but I think one is the focused mindset, which we have. We also have the skill, we have the youthful endeavor, etc. But I think what we have in our health system is an overconsumption because there's no price signal. And it'll affect you guys too, because the price signaling is not just for the consumer but for the provider. Does anyone know what a full blood examination costs, or an 8-O-proline? Because we don't know, we are somewhat indiscriminate with our spending. I think the health budgets in Australia don't have to be so off cue if we were somewhat more targeted with our spending. Again though, it will be our ability as a community to say, and we would call it health rationing, that if you're 80 years old, you don't actually get dialysis. If there's less than a 5% improvement rate for this expensive chemotherapy drug, you can't get it on the PBS. Those sorts of decisions. I think that, but I also like the way that Singapore plans. They're building a new hospital in 2035. Have they built a brick? Not at all. Because they're planning their service and models of care before they build the building. In Australia, we tend to do both at the same time. Or sometimes not at all.
You mentioned the cultural difference, I suppose, in Singapore in terms of leadership.
Yeah.
And you mentioned that it might be a little easier to be a leader over there. Do you see it changing here? Do you see ways in which we can help, I suppose, grow the culture of leadership in that way?
Yeah. So I think it's developing, the issue is developing trust. If our leaders can generate sustainable trust, make decisions, popular or unpopular, but based on what is in the best interest of our community, then I think we will be somewhat there. Ours is different. We have a different type of democracy. We have, the temptation to overpromise, sometimes unrealistically. And when that happens and it's under-delivered, the community loses trust. And look, it's a lesson I'm learning too, because I don't like to tell my, it's counterintuitive to tell someone no. But I think if we develop that, I think that's pretty fundamental.
What advice would you have for those of us who would like to embark on a surgical journey,
Yeah.
but are already husbands and fathers, when, at the beginning of this kind of
Yeah.
journey?
Yeah, you can't do it on your own. And while you might think that surgery is the most important thing in your life, it is not. Your generation is a bit different from mine, because we all had undergraduate years and we were our DNA was finish school, get to uni, finish uni, get into training program. When my daughter told me she wanted a gap year, I kind of went, what's a gap year, right? But it was the best year for her. And when my younger son said he wanted a gap year, etc., I think the trick is you need to be smart with your time investment. I think you had your son between Viva, and babies are easy because what can they do? But toddlers and people need to go to school and get dropped off, etc. So my leadership is on the coattails of my wife. If my wife didn't show me the support that, and we didn't work as a team. I guess the short answer is it's very possible. It's not a mutually exclusive thing, and you just need to find that right balance. Okay? Josh?
What are your thoughts on how international students should go through both high school and university nowadays, and what do you think they could do to optimize going into the workforce and excelling, such as yourself?
They need to stop being international students. And by that I mean they should just be students. Second year, when I was tutoring, Josh, at Melbourne University, sometimes after lunch things get a bit drowsy. How many times can you look at the divisions of the internal iliac artery? I would say, okay guys, wrap up, let's go to the pub. All right? And my international students would go, what? Pub? Never been to a pub. I said, you don't have to be worried. You can drink orange juice at the pub if you want. I think it's that integration into, and our med school here is not so big that you wouldn't be able to do that. So international students need to, they bring their own flavor and so on, but the sooner they assimilate, I think the more effective that they are. So I'm actually an anti-segregationist. Having been an overseas student myself, my development occurred when I mixed with everybody else. I didn't just hang out with the overseas students. Yeah, that would be my suggestion.
Just to follow on that,
yeah.
Did you actively learn anything about Australian culture or things like that when you first came?
Because I had a brother and sister, it was sort of good. Although, they told me that it was all like the Sullivans. Have you ever watched the Sullivans?
No.
Yeah. Yeah, so I was thinking this is going to be 1950s Camberwell, but no. Australia, I keep getting asked, because my skin color, and I keep forgetting that, is different from yours, right? I keep getting asked, is there racism in Australia? Well, if there is, I've never experienced it. But then I wear a suit and drive a Porsche. Perhaps if I was in another thing, right? Australian culture is unique, but Australian culture is very open and welcoming. Some of us get sensitive with some of the things that are said of us, etc. Did I learn anything about Australia before I came? Nah, Mum had like a Rolf Harris record. Well, and then, yeah, it's the culture is the one you create for yourself, so I assimilated quite quickly. My wife is Tasmanian, but in many respects our shared values are probably more akin to mine than hers. So yeah, hope that answers your question. Just try not to be different. Be different because you are naturally so, but don't be afraid to be different, but be open and engage with each other. Any other questions? Any from you girls before you guys have been quiet?
A lot to take in. I think I was just wondering if, what you said about being a father and still prioritizing family, how you've seen that work out for your female trainees and what advice you would have. Yeah.
So the Board of Vascular Surgery, we have between 2011 and now, we have progressed from 5% of our intake to 15% of our intake are females, although the number of applicants are probably more 50-50. We've introduced part-time training. And I have to admit, I was skeptical initially of what part-time training might look like, because I trained like Denby and Chris, high volume, lots of overtime, emergency work, etc. But I've actually come to realize that in fact it's developing those technical skills doesn't need that sort of punishing overnight stuff, and that if you structure part-time training appropriately, you have to hit the same goals. Just because you're a part-time trainee, it doesn't mean that your goals are any less. but it is still very possible. There's 2 female vascular surgeons in South Australia. Sharon's just come back. She's had Dash, her second. And these are people that you should go and speak to. Initially when women came into surgery, my observation was they were more male than the males, because they felt that was the way to get through with surgery. No, you can be a part-time male surgeon if you want, but those choices come with consequences. So it might make your practice a more elective practice than not. You might need support for doing cases where you have low volume experience, but leadership means you help each other, and so yeah, very possible. And not, I'm not sure whether my daughter will do surgery, but it would be nice actually, but but I don't know. Are you guys happy? Yeah.
You say you founded the International Medical Student Society
at
university.
Yeah.
How much of the domestic students were involved or participated in activities that you were arranging as president?
They were hugely supportive, and in fact that was the great thing, because they didn't. We initially felt that they might go, well, what's the need for this? Because we have MSS anyway. But I would say a large number of them were supportive of us, would come to functions that we held, and that was great. Yeah. As I say, Australia is a very welcoming place. We have fringes in society anywhere in the world, but my experiences have always, the majority have been very positive. Okay, guys, thank you for listening.